Welcome to the Partnership for Healthy Cities Summit 2025. Please take your seats in the main plenary. The morning session will begin shortly. Welcome to the Partnership for Healthy Cities Summit 2025. Please take your seats in the main plenary. The morning session will begin shortly. Welcome to the Partnership for Healthy Cities Summit 2025. Please take your seats in the main plenary. The morning session will begin shortly. Please take your seats in the main plenary. The morning session is about to begin. Please take your seats in the main plenary. The morning session is about to begin. Please take your seats in the main plenary. The morning session is about to begin.
Home create, home resist, 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 home. They say home is where the heart is. But sometimes the hardest part is knowing what the heart wants. Bousculés par le temps, les jours s'estompent vers un futur qui paraît incertain. And sometimes the light shines so bright and the way forward rings so true. Se retrouver dans le regard d'autrui. Tant de surprises que la vie nous réserve. To build a home that stands tall, defying the winds of uncertainty. Teintée de toutes les couleurs, une cascade de beauté. Voilà ce à quoi ressemble mon foyer. For you, for me, a home for us.
Pour oublier ma peine immense, je veux m'enfuir, que tout recommence. Oh, ma douce souffrance. Je remue le ciel, le jour, la nuit. Je danse avec le vent, la pluie. Un peu d'amour, un brin de miel. Et je danse, 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 danse. Et dans le bruit, je cours et j'ai peur. Et c'est mon tour, revient la douleur. Dans tout Paris, je m'abandonne et je m'envole, vol, 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 vol. Que d'espérance.
L'amour est un oiseau rebelle que nul ne peut apprivoiser. Et c'est bien en vain qu'on l'appelle, s'il lui convient de refuser. Rien n'y fait, menace ou prière, n'en parle bien, l'autre se tait. C'est l'autre que je préfère, il n'a rien dit, mais il me plaît. L'amour est enfant de bohème, il n'a jamais, jamais connu de loi. Si tu ne m'aimes pas, je t'aime. Si je t'aime, prends garde à toi.
Quelque chose en toi ne tourne pas rond. Un je ne sais quoi qui me laisse le ton. Quelque chose en toi ne tourne pas rond. Murmure de la vie le matin des nuits folles. Rien ne t'affole et j'aime encore mieux ça. Je préfère ça. Oui, j'aime encore mieux ça. Car c'est vraiment toi et rien d'autre que toi. Non, rien d'autre que toi. Que toi.
Des yeux qui font baisser les miens, un rire qui se perd sur sa bouche. Voilà le portrait sans retouche de l'homme auquel j'appartiens. Quand il me prend dans ses bras, qu'il me parle tout bas, je vois la vie en rose.
Oh yeah, alright, don't stop the dancing. One more time, we're gonna celebrate. Oh yeah, alright, don't stop the dancing. One more time, we're gonna celebrate. Oh yeah, one more time.
L'inspiration est infinie. She flows freely from you to me. L'inspiration est immortelle. She transcends life and death with a story to tell. L'inspiration n'a pas de frontières. Elle traverse la terre entière, and you can even find her right here. She travels at the speed of light. To fight her is pointless. Se laisser aller est la seule réponse. Paris, ville lumière, muse de pierre. Ses routes, ses pavés sont faits pour inspirer. And I found her right here in these streets, sometimes crowded, sometimes quiet, but always calling. Paris, city of light, city of resistance, city of my inspiration.
Good morning, everyone. Bonjour, and welcome to Day 2 of the Partnership for Healthy Cities Summit. Very soon, we'll announce the winning cities being recognized this year for their outstanding work fighting non-communicable diseases and injuries. And I want to thank the teams from those cities and everyone here for the work you do every day. It really is helping to save and improve an awful lot of lives. And even with everything going on in the world, that should put a smile on your face today. I also want to give a big thanks to our host. She's someone our team at Bloomberg Philanthropies has worked with in many ways, from improving public health to fighting climate change. On those issues and many more, she's a bold leader who's never afraid to do what's right. Her work has made the future of the City of Lights even brighter and helped set an example for mayors everywhere. Please welcome my good friend, the Mayor of Paris, Anne Hidalgo.
Thank you so much. Thank you, Mike. Thank you for this wonderful morning together and for the energy of all these artists we see before. Merci beaucoup d'être ici. Je vous souhaite la bienvenue. Bienvenido también a todos los amigos, alcaldes y amigas de todos los países de Sudamérica y de Asia. Welcome to you. I'm very, very happy to having you in my city, city of light, but city of love, and your city, because this city is an amazing and creative city, like all the cities, because we share that with all my colleague mayors. We love our cities, of course. We live in our cities, and we share this love for this level, this very, very, very important, nice level, who we can work for the people for better life. Thank you for being here. It's an honor to having you in this room in Paris today. I stand before you 5 years after the COVID pandemic and its impact, but today we still experience troubled times for global health. And the difference between what we experimented and learned in 2020 and what we are experiencing in 2025 is huge. 5 years ago, we have together in all our cities, in all our countries, we have undergone a real cultural shift and realized how vulnerable we are. COVID-19 was not only a health crisis, but the brutal revelation of our mutual dependence of body and society, of city and nature, of health and politics. My dear friends, I would like to share this morning 5 key messages with you. 5 messages for the health of our cities, their population, and the world we share. They are, of course, the results of my experience and my experience with you and with Bloomberg Philanthropy. And I will thank one more again Mike and you, Patti, and also because we are working with you and we believe in your organization, in this international organization. It needs 5 messages, and firstly, our health needs science. We need science. It needs independence, research, and academic freedom, because public health is based on free and accessible data. It was we are doing also with this team, with this partnership we have together. It needs free researchers who can study what they consider necessary to restore our knowledge in our common interest. Secondly, our health and the health of our environment are interconnected. We must preserve ecosystems and biodiversity. We must, in particular, stress the existence of climate change, fight against global warming, and adapt to its consequences. I wish to praise the decision of the Partnership of Healthy Cities to extend its range to action to the resilience of cities to heat waves and extreme heat. We have that also in Paris, and it's very strange for us to say that today. In Paris, we act. We planted vegetation in schoolyards, create school islands, and reduce artificial soils. But we know we always have to go the extra mile. We must also keep fighting against the industries that poison our air, our water, and our food also. Restoring our environment is essential for living in better health today. But it is also important for the future to prevent new epidemics and new risks from emerging. The 2 subjects, we know that, are linked, and it is precisely people suffering from non-communicable disease. And thirdly, good health for us depends on the healthy population in the north and in the south. We are dependent also. I believe this strongly. A society in good health is a society that fights against inequalities. Whether we are talking about COVID, AIDS, addiction, accident, or cancer, illness, and disability, never affect everyone in the same way or with the same consequences. Social, educational background, inequalities shapes our chance of being born, growing up, living, and aging in good health. To limit the effect of these inequalities and protect the most vulnerable, we must continue to invest in public health policies and in international cooperation. This is one of the most important key. Firstly, our health needs also, we know that because we are also politicians, political courage. I say it again with force. Reducing, for example, the place of the car traffic in our cities, creating low emission zone, changing the way we get our food, but also vaccinating children, we know that today they can provoke resistances. We know that, and we are facing that. And while the public debate is necessary and good, it is our responsibility as mayors and politicians to ensure that the right decisions are made and to prevent conspiracy theories and lies. There are moments when to govern is to decide, and those moments are now. Finally, my dear friends, our health depends on local action. We know that also. And this is why I will call the right approach one of proximity, rapid response, and rebuild trust, because we need rebuild trust. The cities have proven their capacity to lead innovative and efficient policies, and all of you here, members of the Partnership of Healthy Cities, are living example of this collective strength. Thank you for your day-to-day commitment. And in the world at times anxious about itself, let's keep hope. Our cities show what is possible. Our cities lead the way. Before welcoming my dear Patti, the CEO of Bloomberg Philanthropies, to this stage, I would like to share one last word with you in French. Mes chers amis, à Paris, nous avons organisé les Jeux olympiques et paralympiques. Ce fut un moment extraordinaire. Mais ces Jeux, nous les avons organisés et j'ai voulu, dès le début, que ces Jeux soient justement inscrits dans un programme qui transforme notre ville, qui rende cette ville plus respirable, qui la rende plus agréable pour la population, qui la rende plus accueillante, plus ouverte, plus saine, plus sûre. Et c'est possible, nous avons pu le faire, et je crois que beaucoup de Parisiens, de Parisiennes, de Français qui étaient sceptiques, qui étaient inquiets. C'est peut-être une façon d'être français que d'être sceptique, et encore plus parisien. Mais beaucoup, lorsqu'ils se sont retrouvés dans nos rues, avec d'autres personnes venues de toute la planète, pour partager à travers le sport, à travers un événement, à travers l'art, la beauté de notre ville, mais en même temps cette conviction que même dans une ville très historique, très traditionnelle dans sa construction, il était possible d'être engagé sur les défis du siècle et de faire en sorte que la santé environnementale, la santé mentale soient des éléments intégrés, complètement intégrés au but que nous avons poursuivi pendant ces Jeux olympiques et paralympiques. C'est possible. Je crois que nous avons aussi fait la démonstration que la santé nécessite des politiques globales, des politiques soutenues par le niveau international, et je redis tout mon soutien à l'OMS, mais aussi, bien sûr, des politiques qui se réalisent à l'échelle des villes, à l'endroit où on se regarde avec les habitants, les yeux dans les yeux, à l'endroit où justement on peut reconstruire cette confiance dont on a tant besoin pour permettre à nos enfants et à nos petits-enfants de vivre dans un monde meilleur. Merci beaucoup à vous. Muchas gracias y enhorabuena. Patti, the floor is yours.
Merci beaucoup, Mayor Hidalgo, and welcome everyone. It is an honor to have you at our third annual Partnership for Healthy Cities Summit. It's great to be among so many dedicated public servants. I spent a very big part of my career in government, and I know how important the work you do truly is. I also know how busy you are. So a special thanks to you all for being here. And let me also recognize and thank the fantastic partners at the World Health Organization and Vital Strategies. Let's give them a great round of applause. We're excited to have representatives from more than 60 cities serving hundreds of millions of people. And I can't think of a better place for us to gather than here in Paris. Thank you to the City of Paris and Mayor Hidalgo again for being such gracious hosts. Of course, there's never a bad reason to be in Paris, in the City of Lights. But as Mike mentioned, under Mayor Hidalgo's wonderful leadership, Paris has been lighting the way to all of us in so many ways. And that includes all of her bold efforts to launch and confront climate change, which are improving people's lives here in Paris and inspiring cities all over the world. She has helped to make Paris a global leader in passing and implementing public health policies that combat non-communicable diseases and injuries and prevent injuries as well. At Bloomberg Philanthropies, we had the privilege of partnering with the mayor and her team, including on a project to install air pollution sensors near schools. I remember the day, very well day when we started the program. It was amazing. And spreading sound, effective, and proven ideas is what this convening is truly all about. Cities are on the front lines of combating the world's biggest problems. We all know that. And those problems are getting increasingly more challenging, especially as public health is under attack. But as Mike says, nothing important is easy, and there's no more important job for a mayor than protecting public health and safety. And in fact, one of Mike's proudest achievements as mayor of New York for 12 years was increasing New York's life expectancy by 3 years, far more than the national average when he was mayor. As mayor, he took on some of America's most persistent public health challenges: tobacco, obesity, and gun violence. And our policies were not always popular at first, exactly like Mayor Hidalgo said. Just ask anyone who was a smoker in New York. But they were effective. And a few years after the smoking ban was passed, we banned smoking in bars and restaurants, and then Paris did. And at the time, that was practically unthinkable. New York's success became a model for other cities, and smoking bans have continued to spread, saving countless lives around the world. I'm sure many of you have very similar stories about policies that were initially met with a lot of opposition and eventually proved not only effective, but popular. So we all know it's possible for cities to make progress on the biggest public health challenges we face. The question is, how do we make more progress faster? Because the work could not be more urgent. As we know, non-communicable diseases and injuries are responsible for 80% of all deaths globally. That's a pretty high number. And far too many lives are being cut far too short by things we can prevent. And it's up to all of us to shrink the death toll. One of the best ways to do that is by supporting policies that are proven to save lives and spreading what works. And that's why so much of our work at Bloomberg Philanthropies focuses on helping cities develop the most impactful ways to tackle intractable problems and helping mayors and their teams share the lessons learned. That's also why we're all here today. And I have no doubt I will leave Paris. I never want to leave Paris, but I guess I will, feeling inspired, and I hope you do too. Now, speaking of inspirational work, today we're honoring 3 cities who, like Paris, are lighting the way for all of us. These cities are being honored not just for their innovative ideas and the progress they've made, but also for how replicable their programs really are. So, it's my honor to announce this year's winners of the Partnership for Healthy Cities Awards. And I also want to note that the actual award itself was designed by a world-class architect based here in Paris, Lena Gottme. It's really quite beautiful. We're very happy about that. So the first is for excellence in food policy, which goes to a city that's been confronting childhood obesity head-on by implementing a policy to remove sugary drinks and ultra-processed foods from schools. Córdoba, Argentina.
Nuestra ciudad recorre un camino mejor desde que es parte de esa alianza, porque perseguimos un objetivo común que es mejorar la calidad de vida de nuestra gente. Hola, soy Daniel Passerini, intendente de la ciudad de Córdoba en la República Argentina. Nosotros hemos tomado la decisión de cuidar a nuestra niñez en el entorno educativo, proveer agua potable y en accesibilidad a todos los niños y niñas. Llevamos adelante un trabajo para poder eliminar de nuestros kioscos y cantinas los alimentos ultraprocesados y las bebidas azucaradas. En solo un corto periodo de tiempo, el 60% de los espacios educativos tienen a sus cantinas y kioscos en proceso de transformación. Con mucho honor y un altísimo orgullo recibimos este premio que nos otorga Bloomberg Philanthropies. La Alianza de Ciudades Saludables es un desafío al cual nuestra ciudad no solo se sumó, sino que se compromete. Muchas gracias.
Next, for excellence in surveillance, a city that established its first legal framework for air quality in 2023 and is already seeing results. Fortaleza, Brazil.
Toda essa população ela termina sendo impactada quando a gente investe em energias sustentáveis. Eu sou Evandro Leitão, prefeito de Fortaleza. Foi importante essa decisão que nós tivemos aqui alguns anos atrás de nós estarmos fazendo um monitoramento, avaliação do nosso ar e foram implantados. Agora a ampliação de nossa rede do ar, implantando monitores para que a gente possa ter uma qualidade cada vez melhor do nosso ar aqui em Fortaleza. Fortaleza vive numa busca incessante para nós nos tornarmos uma cidade cada vez mais sustentável. Muito obrigado por estar recebendo esse prêmio por parcerias por cidades saudáveis. Muito obrigado, Bloomberg Philanthropies.
And finally, for excellence in tobacco control. Over several years, this city has established expansive smoke-free spaces and led efforts to reduce smoking among their population, Greater Manchester, United Kingdom.
We want this to be the best place in the United Kingdom to grow up, get on, and grow old in good health. Hi, I'm Andy Burnham, Mayor of Greater Manchester in the north of England in the UK. Make smoking history succeeds because it's a whole city region, whole system approach to smoking cessation. We've cut rates of smoking in pregnancy by 50%. We've developed a toolkit for people working within the NHS. We've also run extensive public consultations. We're also very proud to say Mayfield Park is now our first smoke-free park. Everybody benefits in Greater Manchester when anybody decides to give up smoking. I would like to thank Bloomberg Philanthropies, the Partnership for Healthy Cities, but also Michael Bloomberg himself, who led the way years ago, showing what city leadership could do to improve public health. Together, we can make smoking history.
So congratulations to all the winners. Let's give them all another big round of applause. And on behalf of everyone at Bloomberg Philanthropies, and Mike Bloomberg in particular, we're so grateful to be partners in this important work. Thank you all for being here for this wonderful conference and for spreading what's working in your city around the world and learning from others. So thank you so much, and let's do a picture.
Please welcome to the stage the Mayor of Guadalajara, Veronica Delgadillo, the Mayor of Lusaka, Chilando Chitangala, the Mayor of Helsinki, Juhana Vartiainen, and our moderator from Bloomberg News, Francine Lacroix.
Hi, everyone. I think you're right here, Mayor. And I think we're just waiting for one final mayor. Thank you so much for joining us. What a wonderful event. Has anybody noticed that the artwork depicting the stained glass is actually of Paris? It really shows the beauty, but the power of these cities. Thank you. So we love to measure and track numbers at Bloomberg. So I'm just going to start with two very key facts. I think Patti already mentioned one of them. Non-communicable diseases and injuries account for 80%, 80% of deaths globally. That's 45 million deaths each year. And despite that, 73% of deaths in low and middle income countries, only 2% of global health funding goes towards addressing these non-communicable diseases, which is why it's so important. So mayors, thank you so much for joining us. We're going to spend about half an hour to try and understand some of the tips, some of the things that you've done well, some of the things that you would fight for differently so that everyone can benefit from your knowledge. Mayor, let me start off with you. When you look at the public trust, and it's very clear that after COVID-19, public trust lost in governments around health issues. What have you done to try and make sure, Mayor Delgadillo, that this does not continue, that you've had to fight back to try and change public perception?
Muchas gracias por la invitación y con mucho gusto de compartirles algo de lo que hemos estado haciendo en Guadalajara en torno a la salud primero. Tenemos un Consejo Municipal de Salud que yo presido y con él estamos desarrollando estrategias, por ejemplo, para la prevención de las violencias, para el combate de algunas enfermedades que en México son muy comunes, como el dengue, y también el combate a las adicciones. En otra de las capas de trabajo que tenemos es entender que la salud pública también se trabaja a través de la limpieza. Nosotros tenemos un programa muy ambicioso de la ciudad para transformar la ciudad en la ciudad más limpia del país. Es una ciudad que ha atravesado por muchos problemas en el manejo de sus residuos y esto impacta, por supuesto, en la salud pública. Y en ese sentido estamos impulsando un programa que se llama Limpia Guadalajara, entendiendo que la limpieza de la ciudad impacta en la salud mental y en la salud pública. También trabajamos para dar continuidad a todas aquellas acciones que se han emprendido a lo largo de los últimos años para seguir construyendo en la agenda de salud. En ese sentido, en Guadalajara, yo presido una comunidad de 14 municipios que trabajamos en colectivo con la agenda de la salud. Y finalmente, la visión que tenemos de nuestra ciudad, de Guadalajara, es convertir a Guadalajara en la ciudad que te cuida, poniendo al frente a las personas y trabajando en 3 pilares. Un pilar es el trabajo que se hace en términos de proximidad con la policía. El segundo pilar es todo el trabajo que hacemos en términos de servicios públicos y de espacios públicos, que ahí es uno de los programas que venimos a impulsar aquí, que es el cuidado de entornos seguros para niños, entornos escolares seguros. Y el último pilar tiene que ver con toda la política pública que atiende especialmente la salud de las personas en torno a la salud física y mental.
Thank you so much, Mayor. Mayor Vertainen, we were hearing there about some of the 3 pillars that actually the great city of Guadalajara had put in place to fight and to push for public health. What have you done in Helsinki?
Well, we do a lot. Hello, good morning. I would have liked to arrive yesterday, but then it turned out that in Helsinki we had a surprise visit of President Zelensky from Ukraine, and he was interested in the underground shelters of Helsinki for understandable reasons. That's a very, very primordial thing that cities can do for the health of their citizens, not having bombs raining on them. So that's just a reminder of the world we live in. Then more to your question. We, of course, health is an integral part of my city strategy, has been it, and we have the city's welfare and well-being plan, which has many components: mental health, leisure activities, spaces for leisure activities, sports facilities, and many healthy lifestyles, many others. Perhaps and there are tens and tens of programs and reforms that we have done. Perhaps the most visible ones would be the increase in pedestrian lanes, in bike lanes, in playgrounds, even outdoor gyms that are open to everybody. They are not popular with gym entrepreneurs, of course, but we have judged that is something that will really, cycling and these outdoor gyms will make a difference. But then everything is not rosy. Mental well-being is very important, and we have realized that this unfortunate COVID epidemic has left a shadow legacy of young people not feeling well. There was a mistake in the national policy during the COVID epidemic of too much and too long a period of remote schools and universities, and that has left many young people not feeling well. No, not really mental cases, but not really being at ease with themselves. And we have created low-threshold mental and therapeutic facilities as well. So we do many things. And some of these projects have also been, some of our projects have been facilitated by this Partnership for Healthy Cities, and we are quite grateful to this partnership, and of course to the Bloomberg Foundation buttressing these activities with their financial muscle. Thanks.
Thank you so much, Mayor. Mayor Stangala, what have you done for Lusaka to actually combat some of this public health crises?
Thank you very much. Lusaka is the capital city of Zambia in the southern part of Africa. We have a population of about 3.5 million people, and 70% of the city is unplanned settlement. So we have a peri-urban area which is large. That means that we really grapple with a lot of health challenges. But for me, I think one of the introductions that I would say that has helped the city a lot is also the introduction of the 30-kilometer speed limit that has reduced traffic-related injuries and fatalities. And this was introduced, we started working on it in 2017 when we started working with Vital Strategies. At that time, I was just deputy mayor and not mayor. So I'm very grateful that I've walked this journey with Vital Strategies supported by Bloomberg Philanthropies. So what has happened is that there's a limit of the cars when they're driving, passing nearby a school, they reduce the speed between 40 and then 30 kilometers. And what is so good about it is that when this policy was adopted by the city, that we worked with government agencies, so it has been adopted countrywide. So it's a very good plus for us, it's a big win for us. And then also in 2024, Lusaka adopted its cycling and pedestrian safety policy. But I must make mention that during COVID time, a lot of people in the city were seen walking and doing a lot of exercises. But how do they have safe work paths when we don't have a proper policy and we don't have such kind of facilities like pathways where they can walk and cycle. So it was a bit dangerous for them. So hence the reason why the local authority thought it's very important that we have a policy in place that will command all of us in the city that the infrastructure, when it's being built, when roads are being built, we need to secure such spaces, build them or pave them ways where they can cycle and walk. So for this policy, we are focusing on dedicated walkways and cycling lanes to minimize conflicts among road users and provide a safer environment for pedestrians and cyclists. We have successfully implemented this policy. But obviously, we need to do a lot of sensitization because remember, motorists will not care because they're driving. And then, so now we have to also be inclusive in the city where we have to make sure that we do a lot of sensitization in the communities and have a lot of stakeholders on board so that it can be accepted. Especially when we're coming from a city where infrastructure has already been built, so we didn't leave spaces for planning the way I've seen this time in Paris. So now we are working on making sure that it becomes a nationwide policy so that even when government is building roads in the city or elsewhere, when they adopt the policy as well at the national level, we must make sure that we leave pathways for people to, pedestrians to walk and also cyclists. This means that we are not only catering for the underprivileged or the other class, but we are also inclusive because then it will be good for people to park their cars and walk to work safely without fearing the dangers of an accident or being unsafe in the city. Yeah.
Thank you so much, Mayor. I wanted to ask you about priorities, and maybe let's start with Mayor Vartanian, because you were mentioning that President Zelensky was, of course, in your city yesterday, and he wanted to see bomb shelters. And this really goes to the fact that the world is very unsettling at the moment. There's a risk of possible wars, there's trade tariffs, there's concerns about trade wars as well. So how do you prioritize public health or mental health, given all of the other constraints?
Well, let's say that these, the current security situation has led us to reprioritize in the sense that we really now make a brush up of our crisis resilience systems and our shelters. But it is not as dramatic as it sounds in the sense that most of a country like Finland, next to Russia, it's mandatory to build underground shelters for everybody. We must have them. It's stipulated by the law. But these underground shelters are also mostly used in a city like Helsinki for other recreational uses. Some of them are sports grounds, playgrounds, under the ground for children. Even they might be parking lots, they might be swimming pools. So people know them, they are not afraid of them. And of course, then the law says that they should be emptied at 72-hour intervals if there will be a crisis. Of course, we build them in order not to have to use them.
Of course.
And, but yeah, that's true. Then something. But then, as to the more broader issue, we have a huge array of things where we work with. I mentioned some of them to you, but perhaps I would emphasize one thing that we have really now started to prioritize and understood how important it is, and it is data, or data, as the Anglo-Saxons say. We now use the digital society's means for gathering information on our different areas of the city so that we can compare more privileged areas with more deprived areas. We construct indices of well-being, using variables like unemployment share of people with no college degrees, share of poor people. And then we can gather a lot of data, like looking at their food consumption baskets or at the sports activities, memberships of young people in sports clubs, etc., so that we get a picture of where we really need to put our resources in order to improve it, to improve the lifestyles of young people and even elderly people. And then we now have started using the the tools of modern statistics and econometrics to look at where we get the most bang for the buck. So I would say data analysis, analysis of outcomes and efficiency of the use of our resources. Thanks.
Thank you. Mayor Delgadillo, how do you actually prioritize? And again, a lot of the root causes in non-communicable disease could lie outside public health. It could be tobacco companies. So how do you also engage with those stakeholders?
Primero es entender que la salud no está separada del resto de las agendas que son importantes para las personas. En el caso de Guadalajara entendemos que cuidar a las personas, de cuidar la salud de las personas es lo central y también es una de las tareas más importantes que tiene el municipio. Entonces, en ese sentido, se desarrolla una serie de estrategias alrededor del cuidado de las personas. Nosotros entendemos que si trabajamos para el cuidado de su salud física, pero también de su salud mental, estamos trabajando para el bienestar de las personas, que al final de cuentas es lo que se enfoca en los municipios. El proyecto que venimos a presentar y que trabajamos de la mano con ustedes en esta alianza de ciudades saludables, por ejemplo, lo que brinda es mejores condiciones para que las niñas, niños que van a la escuela puedan llegar con una integridad física, que no se expongan a un accidente, porque un accidente puede hacerles perder la vida o dañar su cuerpo para todo su vida, ¿no? Entonces, nosotros entendemos que al cuidar la integralidad de los niños al llegar a la escuela y también de sus cuidadores, pues estamos priorizando el bienestar de las personas, pero también al hacer este ejercicio estamos haciendo las funciones que nos competen como municipio, que es cuidar la infraestructura, cuidar los entornos, trabajar en comunidad con las personas y también desdoblar una serie de políticas públicas que permitan el bienestar de la gente. En ese sentido, creo que entender que el bienestar de las personas, entender que la salud es prioridad, permite una toma de decisiones muy clara por parte del municipio, también que las tareas no son aisladas, que cuando uno, por ejemplo, trabaja en infraestructura, trabaja en política pública, cuando uno trabaja en la seguridad, cuando uno trabaja en los servicios públicos, está trabajando al final de cuentas por el bienestar y la salud de la gente. Entonces, en el caso de Guadalajara entendemos que nuestro fin último es que las niñas, niños, los adultos mayores, las personas con discapacidad puedan vivir bien y puedan vivir bien su ciudad y puedan tener condiciones de seguridad y salud. Entonces, todo el trabajo que hacemos alrededor es integral y busca, al final de cuentas, eso, el bienestar de las personas.
Thank you so much, Mayor Chitangala. Can you give us a sense again how difficult it is in these, many unknowns, and other parts of the city also need you to focus on public health, and maybe also talk about some of the other stakeholders, like tobacco companies or big lobby groups, that you have to try and either fight or get on board?
Yeah, thank you. It's very important that when we're working in the city to just achieve, we have to make sure that we balance public health initiatives with the above, and making sure that we involve collaboration across various sectors. For us in Lusaka, we've taken what we call a bottom-up approach, where we really need to involve community members and get feedback from them. And that doesn't just mean community members. When we're going to talk about public health, we need to involve the health professionals and also the urban planners, and that's what we've been doing, just to ensure safety measures are aligning with the broader city goals. So for us, the cycling and pedestrian safety policy that we are now implementing has been a priority, just to reflect the focus on creating healthier urban spaces. And to come up with this policy, we really needed to do a lot of work underground, and to make people understand why this is important. But not only those community members, it was important for me to work with my civic leaders to have a good buy-in, because as mayor, I work through my councillors, so it means that they need to have a buy-in. And we had to actually go to a different city who are also doing, who already have an infrastructure for cycling and walkways. Though they didn't have a policy, they were supported by another organization. But as soon as we went there, and my councillors saw what was happening and how important it is to include people. And when you make infrastructure for the people, you really have to make sure that they have a buy-in for them to embrace and appreciate it. and my councillors were so happy and impressed about it. So it was very easy for us to pass that policy. So I know that working with community members, civic leaders that will have a buy-in and support the initiative, and also other stakeholders, like people that live and work in the city, organizations, it's very important that we work together and then have all these things on one plate just to support a policy like that one or any other initiatives that we have for the city.
Thank you so much. We know, and we've heard actually from all of you, some of the priorities, some of the policies that you put in place that not always are easy. Could you give maybe a little bit of advice to some of the technical leads, but some of the mayors here on what they need to do to put this as a priority? Was there a difficult time that you've had to push something through or do something that wasn't liked by others that in the end you knew was the right thing, Mayor, and it really made a difference?
Es comprometerse con la visión o el objetivo que uno tiene en la ciudad. En el caso de Guadalajara, nosotros hemos abrazado una visión muy clara y también estamos trabajando con todo el personal de gobierno. Empezamos también capacitaciones. En Guadalajara trabajan 12,000 personas, son 12,000 funcionarios públicos que atendemos a 1,400,000 personas. Cómo invitarlos a que también se sumen a la visión de ciudad, también es explicarles en qué consiste, hacia qué horizonte queremos llevar a Guadalajara, por qué queremos convertir a Guadalajara en esta ciudad que te cuida. Y cómo lograrlo es sensibilizando, compartiendo la visión y también aclarando muy bien cuáles son las tareas y cómo cada una de las personas del gobierno forma parte de esta misión. Es muy difícil que los trabajadores, en el caso del ayuntamiento, se sumen si no tienen clara cuál es su tarea y cómo cada uno de ellos aporta para poder convertir a Guadalajara en esta ciudad que te cuida, pero también es mucho trabajo de concientización con la ciudadanía. En el caso de nuestra ciudad, creemos que la mejor forma de abrazar la visión de ciudad, en lo que estamos trabajando por el pilar de la seguridad, el pilar de los espacios públicos de calidad y buenos servicios públicos y el pilar de la política social, solo se va a hacer posible si se abraza con corresponsabilidad. Ahí nosotros estamos emprendiendo campañas de trabajo también con la ciudadanía, hacerles consciente de que construir la ciudad que ellos anhelan y que ellos merecen y servirlos y recibir los servicios públicos que ellos quieren también depende de ellos. Es un trabajo compartido. Y nosotros estamos a punto de iniciar una nueva etapa de la campaña de limpieza de la ciudad y en esta siguiente etapa vamos a involucrar a los medios de comunicación, también a los empresarios, a las empresarias, a las universidades y a todos los sectores de la sociedad para que juntos podamos avanzar con un mismo objetivo. Entonces, en el caso de Guadalajara sabemos que los retos son muy grandes y si queremos hacer de Guadalajara esta ciudad que te cuida, la visión tiene que ser compartida con todas las capas y que el liderazgo que pueda tener el municipio va a ser fundamental para que también la sociedad se pueda sumar.
Thank you so much, Mayor Vartanyan. What's your best piece of advice of something that was difficult to put in place, but then you reaped the benefits?
Well, this was not a thing resisted by many, but my recommendation of priority would be to gather data, look at it, and try to do what is the most effective to combat or to promote whatever objectives you have. After all, if you see unhealthy lifestyles in some part of the city or accidents or school children not feeling well, what should you do really? You don't know whether the best thing is to talk to parents or increase the amount of special teachers or change the composition of school meals. But you can use data and analysis then to get some guidance on these issues. And I would also want to express my gratitude to this Partnership for Healthy Cities and Bloomberg, since this data gathering effort that has now been initiated and that will yield us some great returns, I hope, in the future. That has been partly facilitated by this partnership, and it is very valuable. And this is, well, it rhymes with my past life as a research economist, but I guess we can improve what we do by doing what is the most effective way of achieving those outcomes we wish for.
Thank you so much, Mayor Chitangala.
Yeah, thank you very much. For me, I think with my team, we've learned that when we want something done in the city, it's important that we don't only do stakeholder engagement in the communities, but the government agencies are very important, especially where policies are concerned. For us, the cycling and pedestrian policy is one of the most important one, and we just don't want it to be a policy for the city. We're now working with government agencies so that it must become a nationwide policy. This reason we've come up with this, why we're pushing it so hard is because, for example, a city like Lusaka, we already have existing infrastructure. And then when government itself is making these roads, and they've made quite a bit of roads the last few years, in the last 10 years, they haven't built roads where you have the pathways where you can have a cycling lane or maybe a pathway for pedestrians to walk. So this policy will make sure that it will be a mandate that when they're building this infrastructure, we need to think about having a proper pathway and cyclists for the people. But all this can only be achieved when you collaborate with other stakeholders that live in the city and making sure that the communities understand how important this is. But also we have achieved such things because we've had good partnerships. Partners like Vital Strategies who have supported our policy, actually. I must really thank you for that. We've been really supported, and this took about 2 years of working on it, and we've achieved it. So we are very happy with that. And then for us, because we've always used a bottom-up approach, we have found that all these things that we do for the communities are accepted because we get the feedback from them, and we also work on the information that we gather from them and other stakeholders that live and work in the city.
Wonderful. Thank you so much to all three of you. Please, could I have a big round of applause for Mayor Delgadillo, Vartanian, and Chintangala. Thank you. Thank you so much.
Please welcome to the stage from the United Nations, Corinna Hawkes.
Good morning. Good morning to all. Honourable Mayors, it's an absolute pleasure to be here. And thanks for asking me. I'm Director of Food Systems at the FAO. To be amongst such a wonderful and committed group of people and cities working so hard to make change. Urban food policy is key to that change, with a powerful role to play in advancing the well-being of people in our cities. Their first power is that they change the food environments around people in cities, the availability, the affordability and appeal of foods as people go around their everyday lives in streets, in stores, in schools and way beyond. I know many cities who are part of Partnership of Healthy Cities have been making these changes. Montevideo in Uruguay has introduced nutrition standards in public institutions. London in the UK has advertising restrictions. Quezon City in the Philippines requires restaurant chains to include nutritional information on menus. Lima, Peru has issued an ordinance promoting healthy eating in the city, including regulating the sale and advertising of unhealthy foods in schools and public spaces, promoting local fresh food markets and implementing nutritional education programs. By discouraging the presence and visibility of unhealthy food and encouraging the accessibility of healthy food, cities are pushing on boldly, taking measures where national governments often shrink away, fighting industry interference, insisting on taking action against the flood of ultra-processed foods in their cities, while advancing opportunities for local people to connect with fresh, healthier foods in their neighborhoods. A second power of urban food policy is that it can connect with people. With people's daily realities, with people's often harsh realities, given the significant inequalities we often see. In work I was doing a couple of years ago, and work I was doing a couple of years ago before I started at FAO with the colleagues from a range of cities in South Africa, the Philippines, the UK, we were working to understand the lived experience of food environments of people living in low-income neighborhoods, in poverty, and in food insecurity. What we found was that improving health cannot just rely on changes in food environments. It also needs changes in the infrastructure in which people live their lives and greater attention to gender equity. We found that women turn to ultra-processed foods, not just because they are there and they are promoted, but because they provide solutions to their own lack of time, solutions to an unreliable and often dangerous energy supply, solutions to a lack of kitchen space, solutions to living in shacks prone to flooding and other environmental hazards. Instant noodles and sugary instant cereals are, after all, much quicker to prepare for time-poor women with undue burdens of food preparation. And while vegetables may be available in these communities at relatively low cost, preparing them in unsanitary conditions is not always a wise move. So urban food policy can be even more powerful when it considers this full picture of people's realities. Taking these realities into account can help the policies put into place to work more effectively, more efficiently to advance health of urban population, indicating, as the Mayor of Lusaka was just talking about, an important role for co-creation and participation in the development of urban food policy by the people who really experience the problems. The third power of urban food policy is that it is a great connector. By placing health into the broader interconnections that make up food systems, urban food policy connects multiple issues for multiple benefits, so bringing a broader constituency together to work together for change. In 2021, for example, the city of Puerto Viejo in Ecuador adopted a law designed to provide children in schools with safe, fresh, and diverse foods. But the law went beyond supporting child health. It also aimed to support family farmers and local agricultural development. It took smart moves to make this happen, overcoming real blockages to change, changing the procurement mechanism, established governance to connect the range of different people involved. But it meant that the policy began to change the system that underpins the food supply, with potential for more systemic, lasting change. These types of activities interlink with health in other ways, since they can build economies that affect the degree of migration into cities and support enterprise development among people struggling to find employment and thus experiencing food insecurity and poor health. Added to this is the important connection, as the Mayor of Paris indicated in her remarks, with the health of the environment. In 2017, as many of you will be familiar, the Mayor's Office of Food Policy in New York City made a conscious decision to use its multi-million annual food procurement budget to deliver co-benefits for health, environment, and economy. Through the Good Food Purchasing Framework, not only were children served healthy food, but between 2019 and 2022, there was a threefold increase in procurement for minority and women-owned food enterprises and a 20% decrease in greenhouse gas emissions from city food purchases. That's powerful. This approach to urban food policy that builds connections across sectors and urban-rural boundaries is increasingly recognised by cities. Melbourne's Food City 2024-34 policy sets out a whole vision for food systems. Nairobi and Kisumu counties in Kenya have food system strategies with budgets allocated by specifically designated food, agriculture and livestock departments. I was just talking earlier with colleagues from Bogota, where my colleagues at FAO have worked with them to develop a regional supply system strategy for food into the city. Colleagues are working in cities throughout the world, including right here in Paris, to make markets and other places where foods are served a node where agriculture can link with food systems in cities, in turn linking with health. There is a tremendous opportunity to connect all of these different food-related activities in cities for systemic change, to build portfolios of interlinked initiatives for greater impact. My call to action would be to make these connections in your cities, making the powerful work you are already doing even stronger by building one more bridge, enabling urban food policy to deliver its full power. Thank you very much. Now you heard, and many congratulations to the city of Córdoba for the award that they won earlier for their work on urban food policy. I now have the privilege of inviting Intendant Daniel Passerini from the city of Córdoba onto the stage for a conversation. I will be asking questions in English. He will be responding in Spanish, so do have your headsets at the ready. So could I invite you on stage, Daniel, please? Congratulations again, and an award clearly well deserved, and I'm looking forward to asking you more about it. I'll wait for you to, no please. Sorry to speak in English. Can you hear me now? Okay, thank you. So as we heard, in 2024, Córdoba introduced a decree mandating that municipal schools and educational facilities should only serve healthy foods. It was a huge win, as we heard, for the city. So can you tell us more about that policy and why you chose to pursue it?
Bueno, en primer lugar, nosotros decidimos en 2021 asociarnos y unirnos a la Alianza de Ciudades Sustentables sobre el final de la pandemia y obviamente analizamos una situación que nos preocupaba desde el punto de vista saludable, que era que nuestros niños no consumían la suficiente cantidad de agua y que obviamente los indicadores de obesidad y sobrepeso en nuestras infancias estaban en niveles superiores en nuestro país, inclusive en muchos países de América. Detectamos que teníamos el 41% de nuestros niños con sobrepeso u obesidad. Y además, solo el 41% de los niños consumían la cantidad de agua suficiente y obviamente consumían en su detrimento bebidas azucaradas y consumían ultraprocesados. Decidimos encarar un procedimiento para llevar adelante la transformación de los kioscos de nuestras escuelas en kioscos saludables y elegimos un programa con la Asociación de la Alianza que se llama Córdoba Elige Agua. El año pasado, en 2024, emití un decreto, el 310, para obligar y llevar adelante en todas las escuelas la transformación de los kioscos en cantinas saludables para eliminar progresivamente los alimentos ultraprocesados y las bebidas azucaradas y ofrecer alimentación saludable en las escuelas. Ese procedimiento se está llevando a cabo de manera muy eficiente y hoy tenemos un resultado a la vista muy importante con ya el 60% de nuestras escuelas en proceso de transformación y con el objetivo que en marzo del 2026 el 100% de nuestras escuelas tengan alimentación saludable en los kioscos y hoy ya sí tenemos el 100% de nuestras escuelas con puntos de hidratación con agua de calidad.
Again, congratulations. Can you tell us a bit more about the public reactions to the policy? As I indicated in my remarks, sometimes there can be pushback to these policies. In other senses, there are constituencies when they're very popular. So what were the public reactions to this policy?
Bueno, el gran desafío fue justamente convencer a la comunidad educativa, que no son solo los alumnos, sino también los docentes y los padres, de que esta era una decisión positiva, que iba a mejorar la calidad de vida. Sabido es que las bebidas azucaradas y los ultraprocesados producen consecuencias
que son en muchos casos irreversibles, desde trastornos bucodentales, caries, hasta obesidad, diabetes, hipertensión, enfermedades cardiovasculares y un montón de complicaciones que cuando la comunidad toma conocimiento comienza a comprometerse. Fue fundamental en esto las tareas de comunicación y de sensibilización. Y en esto debo agradecer el trabajo conjunto que realizamos con la Alianza de Ciudades Saludables, puesto que la participación fue fundamental. Generamos ferias de alimentación saludable, actividades interactivas donde niños, familias y comunidad trabajaron, y también debo destacar el acompañamiento fundamental de las organizaciones de la sociedad civil, como la universidad, el Colegio de Nutricionistas y la Federación Interamericana de Cardiología, que obviamente nos aportaron material y herramientas de comunicación para que este proceso se transformara en un círculo virtuoso. Así que debo decir que la participación y la sensibilización fueron fundamentales para que rápidamente podamos ver resultados. De hecho, en solo un año ya el 60% de los kioscos están en proceso de transformación con intervenciones de arquitectura, pero también debo decir con mucha satisfacción que ya el 10% tiene instalado su kiosco saludable y el objetivo es, en Argentina en el mes de marzo comienza el ciclo lectivo y en marzo de 2026 vamos a tener el orgullo de decir que gracias a esta decisión el 100% de nuestras escuelas va a tener su cantina saludable y va a tener puntos de hidratación saludables.
Thank you. These policies always have their challenges, and obviously it takes a lot of intentional action to work through them to succeed. And now you've spoken about a very specific strategy, but there are broader strategies available to advance healthier diets, both at the urban level and at the national level. So how has Córdoba worked to ensure that the healthier school food work aligns with the city's broader strategy on healthy diets? And how does that then align with the national strategy?
Bueno, es muy importante, en este caso, esta red global de ciudades que hoy estamos integradas aquí, que podamos aplicar las políticas públicas siempre con la solidez de que esa política pública se diseñe basada en datos y que esos datos estén respaldados por evidencia científica. Eso hace sólido el convencimiento. En Argentina hay una ley nacional de alimentos saludables del año 2022 que obviamente tuvo mejor aplicación a partir de que nuestra ciudad emitió un decreto el año pasado para poder aplicarla de manera corriente. No sirven las políticas públicas globales o nacionales si no se aplican y no se comprometen los gobiernos locales. Por eso esta interacción, esta posibilidad de compartir experiencias con otras ciudades nos genera herramientas mejores para poder transformar la realidad. La gente, nuestros niños y nuestras infancias transcurren en las ciudades. Por eso fue muy importante que nosotros aplicáramos lo que esta ley establecía, la ley nacional, en base a lo que es el etiquetado frontal de los alimentos ultraprocesados, para hacerla aplicable y comprometer el funcionamiento de la misma. Que una ley pase de ser una buena idea a transformarse en una acción concreta requiere de un compromiso de los gobiernos locales, de las comunidades que representamos, y en nuestro caso destaco como una herramienta muy positiva el acompañamiento de la universidad, de las instituciones y fundamentalmente decidir modelar una conducta o un hábito en el momento de la vida en que eso se puede hacer, que es en la edad escolar. Eso es lo que nos garantiza el éxito de este programa.
Thank you very much indeed. I'm certainly, and I'm sure I'm not the only one, very much looking forward to seeing what happens in Córdoba into the future, and many good wishes with your excellent work, and again a big round of applause.
Thank you.
Okay, we're now going to move on to the next session, which is a get to know you session. Thank you very much.
Good morning. What a lovely day with lovely people. I'm Joseph Ngamije, and I'm the Deputy Director for Partnership for Healthy Cities in Africa. And today, I have the pleasure of introducing a very special guest all the way from Kampala, Uganda. And for those who don't know, Kampala is one of the most beautiful cities in Africa. So yes, it is. So we are going to learn more about her career, as well as what excites her the most about the partnership. So everybody, Dr. Sarah Zalwango. Welcome. Sarah, how are you?
I'm good. How are you?
I'm good, thank you.
Yep.
Let's start with you telling us who you are. Who is Dr. Sarah Zalwango?
Oh, what a question. Good morning. Dr. Sarah Zalwango is a medical doctor with Masters in Public Health and married with lovely children, 2 of them. And she's an interesting person when you get to know her. She enjoys, she's committed to work, and she enjoys having fun. And I think you've worked with her for a few years, and I think you appreciate that.
Of course.
Yes.
I'm the witness for that.
Okay.
Thank you so much. So what excites you the most about a partnership?
Oh, Partnerships for Health Cities has given us opportunities to learn new approaches to interventions, to learn and share experiences, and to know that, yes, cities are different, but however, irrespective of the various availability of resources, we all share the same challenges. And when you get here, you try to assess yourself. When you see what cities have implemented, you do your self-assessment when you go back, and then you realize that you have to do more. So I love this partnership in that way, but not forgetting the opportunity to travel, to get to see new cities, have fun. Oh, I like the way you've organized this one. This has been the best so far.
Definitely.
I think we keep improving all the time. Well, you get to learn at the same time, have fun, the entertainment, meeting new people. Thank you for the opportunity.
It's my first time to Paris too, so I share the experience.
Yes, the city of lights
yes,
and
definitely.
love.
And how long have you been working in the public health sector?
Public health sector is over 10 years. Okay. I started at the level of primary health care, conducting outreaches, being in the community, and over years I've grown into administration where I influence some decisions and also take part in policy formulations. Yep.
And I'm going to be a bit personal. What are you most proud of in your public health career?
A lot, but mainly saving lives and promoting people's lives. And I remember I took part in the pandemic. I was at the forefront of initiating the emergency medical response. We set up a network of ambulances up to deep in the community level, and it was fulfilling and also improving people's lives. Recently, we had an issue with our solid waste management, so I'm down in the ground, involving the community in all these initiatives, improving sanitation practices, improving mobility, getting to share the initiatives that we do as Kampala. So I'm proud of a number of things in my career.
Oh, perfect.
Yep.
Personal again. What is your favorite food from Kampala? They want to know.
Favorite food, I think, well, I love matoke. I don't know if you've ever visited Kampala. Matoke are those bananas where we cook them in various ways. We wrap them in banana fibers and steam, and, you know, it's really nice. When you eat it mixed with granite pastes that has smoked fish, oh, it is too delicious. Actually, I'm already missing it. I can't take like 2 days without tasting that. Yep. Please, when you visit Kampala, look out for matoke and the granite pastes in smoked fish.
And they are healthy.
Very healthy.
All right.
Yep.
And what are you most excited about for the next few days while you are here?
Oh, next few days, of course, the field visit. Yesterday's was very nice. I can't wait to visit the Museum of Paris, and also further networking with colleagues and sharing experiences and the fun that comes with it.
All right, thank you. That's it.
Thank you, Joseph.
Thank you. It was a pleasure having you here. Thank you so much.
You're welcome. Thank you.
Ladies and gentlemen, you are now on a 15-minute break. There are refreshments outside. Ladies and gentlemen, there's a 15-minute break. Thank you very much indeed.